Welcome to a new episode of Athero Voice, the official podcast of the Hellenic Atherosclerosis Society. I'm Fotios Barkas, Assistant Professor of Internal Medicine at the Faculty of Medicine of the University of Athens, board member of the Hellenic Atherosclerosis Society, and coordinator of Athero Voice. Today, you have the pleasure of hosting Dr. Emmanouella Magriplis, clinical dietitian, nutritionist, and assistant professor at the Food Science and Human Nutrition at the Agriculture University of Athens. Professor Magriplis is a leading expert in nutrition science, lifestyle medicine, obesity prevention, and public health nutrition. Her work spans both academia and clinical practice with a strong focus on behavioral change, personalised nutrition, and the implementation of sustainable lifestyle interventions in real-world healthcare settings. During these years, 11th Pan-Hellenic Congress of the working groups of our society, Professor Magriplis joined us to discuss a fascinating and rapidly evolving area in lifestyle medicine. With a growing emphasis on lifestyle medicine as a crucial pillar in preventing and treating chronic diseases, today's discussion will explore how we can translate theory into practice, overcome implementation barriers, and help individuals achieve meaningful and lasting change. Professor Magriplis, welcome to Athero Voice. It's a pleasure to have you with us.
I'm very happy to be here, and thank you so much for this very important topic of a discussion, Professor Barkas. I think when it comes to sustainable nutrition and lifestyle medicine, this is an important area, and I'm very interested to what I have to hear today and what we have to discuss.
So let's begin with something fundamental. We're becoming increasingly effective at initiating behavior change, yet supporting patients to sustain that change remains one of the biggest challenges. So from your experience, what are the key barriers to long-term adherence, and what evidence-based strategies actually help people maintain lifestyle change in everyday practice?
I think it's one of the simplest questions, but the most difficult areas to go beyond. It's one word: personalization. The huge challenge when it comes to sustaining and having the implementation of all this lifestyle changes that we have to do is whether we personalize it to the individual, to the patient that we have to adhere to. Do we listen to this patient? Therefore, there are specific evidence-based lifestyle changes that we have to do. These are not always easy to do from everybody. So therefore, we listen and we personalize. This is the first step, and this is the first response I will give before we go into more specific details.
So the success of lifestyle medicine depends not only on motivating patients, but also on supporting clinicians and even the healthcare system itself. How can we better equip healthcare professionals and organizations to integrate lifestyle medicine into routine care and ensure continuity of these interventions?
Well, when it comes to clinicians, both of our basic backgrounds, for you, Professor Barkas, for me as well, is clinical. You are a medical doctor, I'm a clinical dietitian from my basic degree. What we learn is the evidence-based, what we should be changing and what is there to work for each individual and for the community overall that have specific risk factors. In this case, though, what is actually lacking? What do we not get support on? What are we not taught? We're not taught lifestyle counseling. So how do we actually deliver all this evidence-based, all this information, all these changes that someone has to do? How do we actually make them and introduce them to the patient out there in order for them to be easily understandable and therefore be able to adhere? So, for example, what is a 10% decrease of 10% of saturated fat and less than 10% of saturated fat in order to have better heart and reduce your heart disease risk? What does this translate to? And how does this go into the patient itself? And therefore, which actual changes does this patient have to do in order to be able to? And not only that, so this is the easy part. How do we tell them how to do it? How do we persuade them? This is where lifestyle counseling comes into place. It's not very often the new term and how we have changed these things and the new area that we have evolved towards and the transition is we're not there only to reduce the bad, but we need to introduce the good. This very often helps, but we need to know that as well, and we need a.
We know now that lifestyle interventions do not affect all individuals in the same way. Biological, psychological, and contextual factors all play a role. So, how important is personalized lifestyle medicines, and what tools or approaches help you tailor lifestyle interventions to each individual?
These are very important questions, and I don't even know how to start by responding to them. When it comes to the psychological approach, when it comes to the behavior, therefore targeting and getting the information, this is again listening. We have the tools, all tools are out there, and validated tools. For example, when it comes to mental health, and whether someone is ready for a change or at which stage potential depression, because we know that chronic disease is highly associated with depression as well. Therefore, we need to know this information in order to know how to actually contact and introduce all these changes to the individual. Therefore, let's go into the PHQ-9 tool. Let's go into the PSS that we have. Therefore, the tools are easy to find. We should not be neglecting them. When it comes to nutritional intake, for example, knowing what the individual actually does before telling them how to change that. So we're targeting those specifics. Therefore, if I'm a vegetarian, why would I say to decrease any animal products, for example? If we don't know this, if we don't actually validate it, our responses to them, we tend to lose the patient because they won't listen to us if we don't listen to them.
Many lifestyle interventions perform well in clinical trials but fall short in everyday clinical practice. So, how can implementation science help us bridge this gap and make lifestyle medicine scalable and feasible in real world healthcare settings?
I will leave nutrition out and go to the next part when it comes to physical exercise. Very often, in order to respond to a specific question, very often I hear that we need to have, based on the guidelines, evidence-based, we need to exercise more, reach specific amount of physical activity, which means for an adult about 60 minutes at least 3 times a day, and having walking over 150 minutes, for example, 3 times a week. Very often we say moderate and high intensity. What does this translate to? So I'm coming back to you with a question because this is something that a patient would ask. I hear doctors and clinicians and dietitians saying that you need to walk 6 kilometers per day. I'm not going to do that. I have no time to do that. And someone with a heart disease, how are they supposed to do that when they're 140 kilos with a BMI, let's say, most evidence that is overweight? No, let's go to obesity. So we have a BMI over 30 and 35 with a heart disease. Will 6 kilometers a day actually help me, or will this increase more problems? And therefore, let's personalize that and reach the 6 kilometers per day and not start from that. So that becomes a lot easier for someone to implement as well. So you build slowly.
Quality data is essential for both monitoring progress and driving long-term change, yet real-world systems often lack integrated lifestyle-related data. What kind of digital tools, monitoring platforms, or data infrastructures do you believe could meaningfully support clinicians and empower patients?
Are we going into AI at this point? Um, there are tools and we need to be using them. It makes our life easier. We don't need to memorize everything anymore. We can use these digital tools. There are digital tools when it comes to like the continuous glucose monitoring, for example, which we need to use. We need to address this. We should not overcome this area, even if we have a good glycosyl hemoglobin. And so therefore we have a patient with type 2 diabetes or diabetes overall. I'm going to type 2 because this is where lifestyle counseling comes into play more. And they are with good results overall, but these are snapshots. What does a CGM though show? And therefore we need the digital tools in this case. And this should be integrated and responsive with what they actually consume as well. So by having pictures, and there are great digital apps in there, therefore combining the two, and therefore getting the information really fast. So based on the clinician, we should not omit, because we're not only talking about the patient, the clinician also does not have a lot of time because of the fast pace that everything has to be done. Therefore, integrating these digital tools all together and the physical activity from the wearables, most of us wear wearables also. Therefore, in the era that we're living in with high technology and why not go to that step before? beyond that and have all this information before being responsive and before personalizing anything we suggest.
On the other hand, lifestyle medicine should be accessible to everyone, not only to those who are motivated or privileged groups. So, how can we ensure that lifestyle medicine interventions do not widen health inequalities? And what does true co creation with vulnerable communities look like in practice?
You're challenging me, that's for sure. Inequalities, the first thing that we discuss, let's take childhood obesity and all of the prevention programs that are out there. Who is actually listening to us? Those that care, those are motivated, those that are not. The way we're actually trying to target and the things that we're saying are not reaching those that are not motivated. They're not reaching those that are lower socioeconomic status because they're not hearing us. We need to change our way. We need to make programs and or formulate specific wordings in order to target those individuals as well. If we continue saying, for example, obese children or obese individuals and not moving beyond that and using the first person's language, which is children with obesity and with overweight. For example, this is number one, because we should not be stigmatizing anybody at this point. We're there to help, decrease, and improve, not show them with our little finger and how to move beyond that.
And the final question. Looking ahead, what do you believe will be the biggest challenges and the biggest opportunities, of course, for the future of lifestyle medicine and its integration into mainstream healthcare?
Number one, the lifestyle counseling. This should be implemented from our basic degree, if not from early on before that. And also, very important, we need to move beyond the patient and stop telling them what to do. We need to be not only telling them what to do, because even if we tell them and give them specific examples, in the era again that we're living, there's so many foods out there that it's not easy to judge and it's not easy to select what's healthy and what's not. We're actually in the healthcare and we still have difficulties of choosing the correct food. And therefore, public health means moving beyond and going into policies as well, and formulating foods and having legislations that will protect the consumer and for them be able to understand or easier to choose the good foods, not only reducing the prices and not only taxations when it comes to sugar and bad fat, but also decreasing the prices in foods and fruits and vegetables and healthy foods that we should be consuming as well. So it's not only what we tell the individual to do, but let's motivate them to select the good foods by having all these changes overall and therefore actually making it sustainable.
So this is the end. Professor Magriplis, thank you for this rich and insightful discussion, offering us a clear roadmap for how lifestyle medicine can become truly effective and sustainable in everyday healthcare.
Thank you for this very important and very pleasant discussion.
And of course, to all of you listening, thank you for joining us. Stay tuned for the next episodes of Athero Voice, where we discuss the latest advances in cardiovascular prevention, lifestyle medicine, and metabolic health.